Good afternoon, everybody. Thank you for being with us here today. We have NDP health critic Don Davies, who will discuss his private members bill, and then we'll hear from our guest speakers. Joining us today is co-founder of Moms Stop the Harm, Leslie McBain, and two representatives from the BC Centre on Substance Use, interim executive director Cheyenne Johnson, and peer clinical advisor Guy Felicella. So without further ado, I'll turn things over to Don.
Thank you, Alana. Good morning, good afternoon, depending where you are. My name is Don Davies. I'm the Member of Parliament for Vancouver Kingsway and Canada's New Democrat Critic for Health. I am calling in from the unceded territory of the Coast Salish peoples, by whose grace we live, work, and play. I am very pleased to be joined by some very special people who have profound contributions to make to the subject I'll be addressing today. Leslie McBain of Moms Stop the Harm, Cheyenne Johnson, Interim Executive Director of the BC Centre on Substance Use, and Guy Felicella, a passionate advocate of sensible drug policy with personal lived experience. There is not one epidemic in this country, there are two. Over the last 5 years, across Canada, 20,000 people have lost their lives to the overdose epidemic. From downtown neighborhoods to our most remote regions, no community has been untouched. Last year alone, over 1,700 people died of opioid overdoses in British Columbia, the deadliest year on record, and a 74% increase from 2019. Tragically, overdose deaths have spiked following the implementation of COVID-19 prevention measures. As a result, Canada recently recorded its highest quarterly death toll since national surveillance began in 2016. And although COVID-19 has fueled this crisis, it did not create it. Decades of criminalization, a toxic illicit street supply, and a lack of timely access to harm reduction, treatment, and recovery services have caused this ongoing catastrophe. It's time to treat substance use and addiction as the health issues they truly are. Today in Parliament, I introduce legislation to do exactly that. It is groundbreaking and the first bill ever to attempt to fully transform our country's criminalized approach to drug use to a health-based one. It takes a comprehensive perspective, recognizing that we need to do everything we can to remove the trauma, stigma, and policies that are themselves causing such serious damage to people and their families, and so needlessly and avoidably costing lives. The Health-Based Approach to Substance Use Act would address Canada's overdose epidemic by addressing all of the major policy areas that need to be reformed. These include decriminalizing personal drug possession across this country, ensuring low barrier access to safe supply, providing for record expungements, and expanding access to harm reduction, treatment, and universal access to recovery services across Canada. It is critical to note that if we truly do view substance use and addiction as a health issue, we must eliminate all of the aspects of criminalization and harm that work against this. For example, it's the poisoned street supply that is killing Canadians by the thousands, by the tens of thousands. Clearly, we will not make a dent in overdose deaths if we don't address this. We can't just legalize the possession of poison. We must eliminate the poison by ensuring that people have access to properly regulated sources. We know that trauma and stigma are core problems of substance use disorder, so we must eliminate the stain of criminal records that stigmatize and re-traumatize people for years, often their entire lives. And we must heavily invest in the health architecture so desperately needed by ensuring everyone has universal access to appropriate treatment and recovery services through our public healthcare system. No one can seriously maintain that the war on drugs is a success or that criminalizing drug use is doing anything whatsoever to discourage drug use or help anyone recover. This bill is the product of long-standing research and evidence, and it has the overwhelming support of a broad cross-section of Canadian society and stakeholders. The City of Vancouver, the City of Montreal, and the Province of British Columbia have formally called on the federal government to decriminalize substance use. Vancouver Coastal Health's Chief Medical Officer, Dr. Patricia Daly, and BC's Provincial Health Officer, Dr. Bonnie Henry, have identified decriminalization and safe supply as urgent and necessary steps to address the overdose epidemic. Even the Canadian Association of Chiefs of Police has endorsed decriminalization and a health-based approach to substance use. Unfortunately, Prime Minister Justin Trudeau has repeatedly ruled out this recommendation, saying it's not a silver bullet solution. That is an irresponsible, groundless, and facile claim. No one suggests that there are any quick fixes to the complex issues surrounding trauma and addiction. However, it is simply undeniable that criminalizing people who suffer from health issues and refusing to address a street supply of poison drugs sold by criminal gangs who don't care an iota about what's in them are major contributors to the harm, deaths, and are policies that can and must be changed. Mr. Trudeau claims that his government's response to COVID-19, and in fact all social policies, are evidence-based and informed by the advice of public health experts. Well, it's time to put that into action. It's time to apply this approach to Canada's other epidemic. It's time to choose rational, evidence-based policy over ideological relics. It's time to end Canada's failed war on drugs. Lives depend on it, and this bill will be a major step forward in doing so. So thank you. I'm now going to turn the news conference over to these very, very special people to share their experiences. First to Leslie McBain of Mums Stop the Harm, who will provide the family's perspective and other comments that she feels germane. Leslie.
Thank you, Don, and thank you for your work. We were very grateful for you to present this bill. A dead person will never recover. We members of Mums Stop the Harm and over 22,000 more families across Canada know this only too well. So many of our loved ones who have perished never had a chance when using the street drugs available now. Whether they were addicted, whether they were using recreationally, or thought they were getting cocaine or ecstasy, they died of a toxic drug poisoning. And practically all these deaths were preventable. We wish they hadn't used. We wish there had been services available to them. We wish that drugs were safe. We wish we could still hold them. The grief never ends. My son Jordan has been gone 7 years, but I could cry right now. When people are addicted to a substance, they have substance use disorder, a condition, the only one wherein a person must access the drug they need by purchasing it illegally, often in dangerous situations, drugs that originate often with organized crime. Imagine if we put people with diabetes or heart disease or cancer in such a position. They rightly get a lifetime of care with the best drugs the world has to offer. A safe supply of pharmaceutical alternatives to street drugs helps our loved ones stay alive and stabilize. There is research to show that people are more inclined to seek treatment when they are stable and balanced. And safe supply and decriminalization are inextricably linked. In 2017, 72% of all drug arrests were for personal possession. The cost to taxpayers of putting people into the criminal justice system is huge. When the loved ones are incarcerated for possession of personal amounts of illicit substances, they experience fear, shame, stigma, loss of self-worth, racial discrimination, inability to get future employment, housing. It's the downward spiral. We must understand the nature of addiction to know that people can't stop accessing drugs just because the law says it is illegal to possess them. Being incarcerated for possession never improved health, never stopped addiction. What incarceration often does is make a person sick and vulnerable. It throws their families into chaos, inflicts legal fees. There is nothing about it that works. We need full decriminalization, no administrative penalties, no non-consensual treatment, no stopping, searching, harassing, confiscating. If a legal safe supply is implemented, criminalization for possession could be moot. Innocent people could stop dying. Families could reunite and work together for a more peaceful life. Until then, please work to decriminalize people. No one deserves that pathway to chaos. Thank you, and I'll hand it over to my respected colleague, Cheyenne Johnson.
Thank you so much, Leslie. And good morning or good afternoon, everyone. I'm Cheyenne Johnson, and joining from the traditional and unceded continuously occupied territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. Yesterday here in BC marked a devastating memorial in our province, 5 years of ongoing unnecessary overdose crisis. As Don mentioned, more than 20,000 Canadians have died of drug overdose since 2016, 7,000 of those in British Columbia alone. And thousands more have survived an overdose and or are dealing with ongoing substance use disorder with very limited supports. This is a national crisis. And one of the main drivers of this national crisis is the ongoing criminalization of people who use substances. It is long overdue that we develop a new framework that decriminalizes substance use alongside changes to the Controlled Drugs and Substances Act to support legally regulating substances. We know from a large body of research and science that criminalizing substance use rather than treating it as a health issue, as a public health issue, perpetuates devastating stigma, ongoing discrimination, and violence towards people who use drugs. It also impacts people's ability to seek employment as well as long-term recovery. Using police and enforcement also drives people to use drugs alone, creating harms that result in overrepresentation in the criminal justice system and billions of direct and indirect costs to us as a society, including the healthcare system, and billions in lost productivity. Decriminalization is an evidence-based drug policy approach that would remove all criminal charges for simple drug possession. In addition to eliminating these drug possession charges, additional changes are urgently needed for law enforcement practices to support decriminalization, which could include ending practices such as street checks, red zoning, the displacement of homeless people, and other measures that negatively impact people who use substances. We urgently need policy changes that focus on a health and public health approach to substance use that promotes health and equity for all people who use drugs. These policy changes must include decriminalization and pharmaceutical alternatives to the toxic drug supply, and critically include investments in an evidence-based substance use system of care to support prevention, recovery, treatment, and harm reduction services. And with that, I'll turn it over to my colleague, Guy.
Hello, everybody. Thanks for having me. And, from my own personal experience with using substances for 31 years, it's safe to say that the war on drugs has gone from defeat to an absolute debacle. Punishment, enforcement, stigma drove me from a community of Richmond into the downtown east side of Vancouver and buried me there for over 2 decades. This cycle of substance use, criminalization, prison, homelessness, poverty could have all been alleviated with a safer drug supply and ending the punishment and the war on drugs on people. This is not a war on drugs. It's a war on people, poverty, homelessness, and it's killing people. If you look at the country of Canada, we spend billions of dollars trying to keep drugs out of our country, but then spend hundreds of millions of dollars reducing the harms of those drugs and health costs to people who are using them. It's failed, and it continues to fail people every single day. What we absolutely need is abolish all records of people who are charged with possession of substances, because finding employment for people, even when they get into recovery, is next to impossible. What also needs to happen immediately, the most urgently needed response, is to have a regulated supply, but also outside of the medical system. And for that to happen, the federal government needs to amend the Controlled Drugs and Substances Act to take it out of a prescription model so that people can have access to safer substances, just like they have access to safer alcohol, just like they have access to cigarettes. All those things, tobacco, alcohol, and substances fit in the same category, and people need that access. Having it through a doctor, the safe supply that's available now is contingent on really a prescriber and a person who has a substance use disorder. Well, there's so many people, so much more people who do not have a substance use disorder that cannot access those safer supply substances. So they use alone because of the criminalization and the stigmatization of drug users face, and they die because of it. Our systems have completely failed people. If the policies that are in place are killing people, then we need to look at those policies, because every life lost is an absolute policy failure. These are deaths that are preventable, and yet we're not preventing them. And this crisis, this dual public health emergencies that's here in not only in British Columbia, but across the country, is familiar to the same crisis that I had to live through in the 90s, which was the AIDS and overdose crisis, where 1 in 4 people in the downtown East Side were infected with HIV, which led to AIDS. I've watched many drug users die of AIDS and overdose in the 90s. This is not a crisis that's been going on in the last 5 years. This has been going on for over 3-4 decades. And really what it's gotten to is the point of the lack of urgency in addressing these systemic issues that have created this, what we're involved in today. It's absolutely heartbreaking that we're making the same mistakes that we made in the 90s as we are in 2021. And so I call on us as people to do better and be better, to help people who are struggling with substances, amend the CDSA so that people who use drugs can access them outside of prescription model. Thanks for having me, everybody.
Thank you very much, Guy. We'll now open it up for questions. I would just ask that you use the raise hand function, and I can call on people one at a time. I believe we already have some hands up, so I will begin with Christopher Reynolds.
Hi, thanks very much for taking our questions, folks. Mr. Davies, I was hoping to ask you, first of all, is the legislation that we're already seeing now on the books with Bill C-22 not a step in the right direction, as well as steps taken by the city of Vancouver and the health minister to exempt that city from the criminal code when it comes to simple possession?
Well, thank you for that question, Christopher. Look, yeah, all of these are positive steps. But what this bill does is it recognizes a few fundamental, I think, realities. One is that this is a national problem. So while, for instance, I think the BC government's request for a province-wide exemption under Section 56 of the Controlled Drugs and Substances Act is an excellent step that only applies to BC. We know that people are dying of opioid overdoses in every community in this country. So that's why I think federal national legislation is required. I also think that this bill is really groundbreaking in that it attempts to take a comprehensive approach. It doesn't just deal with an exemption under the Act. It doesn't just deal with decriminalization of drugs. It also addresses those other, I think, profoundly critical components like a safe supply that Guy Felicella spoke about. It deals with the record expungements, and it deals with the issues of prevention, education, and treatment that I think need to be coordinated on a national basis. So I support every measure from anybody that seeks to deconstruct and demolish the criminalized approach to drugs. But I think we have to realize this is a national problem and we need a comprehensive approach.
Follow up for you. I guess I'm also wondering, given that your bill is unlikely to make it to debate, is its purpose more a symbolic or political statement?
Well, you know, I still remember the great words of Jack Layton where he said, the job of opposition is not just to oppose, but to propose. And in my time in Parliament, I don't think that any party has a lock on good ideas. They come from all sources. And so what I've done as health critic is work on build on the wonderful work of people that you see on this panel and many, many others who have built an overwhelming, compelling case that it's federal policies that are causing unneeded deaths in this country. And so we've taken this very seriously and drafted very serious legislation that's doable, that is fact-based, that has the broad support of stakeholders across this country. And I would hope that any government that truly is taking its responsibility to the health and safety of Canadians seriously to take a look at this bill and adopt it as their own. There's nothing that prevents a government from looking on the order paper and taking any bill that's been drafted and introduced by any parliamentarian and moving that forward on the order paper. And I would call on my Liberal colleagues in this minority parliament to do that with this bill.
Thank you, Don. I believe the next question is from Moira.
Hi, thank you so much for taking my question. On the safe supply aspect of this bill, we've seen that effort pretty delayed, although with some progress in British Columbia here. What do you see the federal government's role being, perhaps widening the path and making way for compassion club-based models, the way Guy mentioned, or non-medical safe supply? And I guess what do you hope this bill could do for safe supply in jurisdictions where that's not even being considered at this point?
Well, that's an excellent question. Well, as a federal politician, the very first thing that I think needs to be done is we have to make sure that federal legislation and policy is not working against those principles. So for instance, right now, of course, there's federal legislation, the Controlled Drugs and Substances Act, that actually criminalizes possession and selling of drugs. So that legislation has to be changed. That's one thing my bill does. But it also goes further and it requires the Minister of Health to develop a national strategy to provide low barrier access to safe supply. You're right, that does require, I think, coordination and cooperation at the provincial and maybe even the municipal levels as well. So, but the fact that we need partnerships shouldn't stand in the way of the federal government taking the action it can and also taking a leadership role in paving the way for that. As you know, right now, sitting on the health minister's desk are Section 56 applications from a number of cities in this country that have yet to be dealt with. I mean, it requires federal approval to give a specific exemption for a particular city. Well, I'm talking about busting that wide open. And instead of this being a good policy just in Vancouver or Montreal, this should be the policy that's possible for every community across this country. And so that's why I think we need to remove the legislative impediments to this in the Controlled Drugs and Substances Act. And I might leave it to Guy or Cheyenne to talk about some models. This bill doesn't prescribe exactly how the low barrier safe supply might be delivered. I think that's something that needs the wide input of a lot of people. Perhaps that'll be done over the counter through pharmacies. There's a number of different ways that this could be done. I think the bottom line, though, is this act says that it's time that we have a regulated supply of drugs so that people know what they're taking in appropriate dosage. And that's not what's happening now. And tens of thousands of people are overdosing every day because they're buying drugs that have, exceptional amounts of fentanyl in them, and they don't even know that it's in the drug. So I think this starts with federal leadership, and that's why I'm calling on the federal government to act.
I can jump in quickly just to say what would really help is that Canada create a domestic supply in Canada and make the substances here in Canada, and then scale up compassion club models, because the medical model will never meet the demand and the need of people who use drugs in itself. Sure, it's a great place for it's necessary, but it's not going to support the many people who use drugs across this country. And that's why Canada needs to act in that way to create it. And that would take an amendment under the CDSA so that could happen as well. So if we can get there, we can save lives. It's really the only thing. And if you look at creating diacetylmorphine across Canada, in Canada, it has about 120 people across the country, which is 38 million people. There's 120 people accessing a HAT program, a heroin assisted program. If you look at Switzerland, which is the population
happen, but we've seen Oregon decriminalize with sort of administrative penalties and mandatory treatment being part of that model. Do you foresee that being part of the conversation, or would you foresee that being part of the conversation should this go towards debate? And if not, what other modes of diversion are you looking at?
Well, this bill very explicitly and in detail calls for the elimination of all provisions for criminalization of possession. It just eliminates them. It also has very detailed provisions for expungement of records, and it calls for a wholesale transformation of our policy to one of health-based. So I'm not exactly familiar with exactly what the Oregon model looks like, but I know that what we must do is completely eliminate criminalization from drug users. We must focus on a prevention, education, and treatment model. We have to make sure that people have access to safe supply. These are ubiquitous now. I don't think there's any serious disagreement among drug policy experts in this country that these steps have to be taken. And I think it's going to require a sea change in policy. But you know what I'll say is I think this is one of those areas where the population is far ahead of the politicians, because I don't think there's a family in this country that has been untouched by addiction. Everybody has a brother or sister or mother or father or aunt or uncle or cousin who has been touched by alcoholism or addiction of one type or another. And I think they know that those family members are not criminals. They are people with health issues. And so that's what this bill seeks to do, is to make that profound, significant transformation to effective drug policy of the 21st century. There are some details that need to be worked out, but I'm confident that stakeholders and experts like the people you're seeing on this panel and people with lived experience joining together can create that structure. But it starts with the realization that criminalization is part of the problem, and it needs to be eliminated so that we can make progress.
Are there any other questions at this time? I'm not seeing any additional questions. So this concludes the press conference this morning.
Thank you all very much for your attention. Stay well.